I think COVID has really changed the game. Essentially, moving forward, we're going to be living in a society, especially within healthcare, where we are required to always mask and protect ourselves from airborne diseases. So in the ER, a lot of times we need to respond to patients quickly. So it's helpful if I have a mask that I can easily put on and take off without having to touch my face or expose myself. And I do that multiple times a day. Additionally, I have to sometimes be in a room for a long period of time, so something that's comfortable that's not going to wear on my face or my nose. And then finally, it's really helpful to communicate to patients. So a lot of the other masks, I couldn't really hear what I was saying or what the patient was saying, and they couldn't understand me. So having something transparent where they can read my lips a little bit and can easily hear what I'm saying makes things easier and safer for everyone. Canopy actually addressed several of those issues. One of the key things that really made me excited about the Canopy mask is that I learned that when we are disinfecting other types of masks, specifically respirators, they utilize an electrostatic force to filter the air. And when you clean them, it can disrupt that electrostatic force and drop its filtration rate into the 70s. So little did I know I was going into work and cleaning off my mask and potentially opening myself up to more risk because I was making that mask less effective. With Canopy, I didn't have to worry about that. I could fully clean the mask and know that it was going to maintain that filtration rate of 95% or higher, and that just makes me feel so much more comfortable. I'm very conscious of how much waste I have at work because I use so much PPE every day. So it feels good that I'm not throwing away a mask every time I come out of a patient room, and that I just have to wipe down my Canopy, and it continues to make me safe but also make the world more sustainable. One of the great things about the mask is also that I don't have to replace this filter as often. The amount of filtration you get based on the hours that I have to wear it mean that I might not need to change this filter for several months, whereas some of the alternatives I was using, I'd have to change the filter every day or multiple times a week, which is just another cumbersome step that I didn't need to deal with as a busy ER doctor. I was really pleased when I learned that Canopy was coming out with an integrated face shield, so I always have to wear a mask plus eye protection. And oftentimes, again, there would be an issue with the comfort of the protection of face shields and them wrapping around my head, being too tight, not really integrating with the mask well. So the Canopy face shield has been a great addition to giving me really full facial coverage and easy to use. It can actually pivot upwards and be adjusted to fit my face comfortably, and it's been such a great additional feature.